COVID-19 cases from across the world crossed the 26 million mark over the weekend by more than 800,000 new cases from the last count on Friday. And this brings the new total to 27,143,630. The death toll is put at 889,352, while recoveries have entered the 18 million zone. With well over 6.2 million, the U.S. retains its lead on the list of most impacted countries of the world, while India has surpassed Brazil as the country with the second highest number of COVID-19 cases in the world, with 4,204,613. Brazil is now at number 3 with 4.1 million cases. Russia follows with a distant 1.027 million cases at number 4, while Peru is even more distant with 689,977 cases at number 5. Welcome to COVID-19 Myths and Facts. Now, despite the fear of the spread of COVID-19, many parents in Iran have welcomed the government's decision to reopen schools after a 7-month closure, highlighting their children's need for education, though others say they still had some concerns over the spread of the virus. Schools in Iran reopened to 15 million students on Saturday for a new academic year. At a school in Tehran, students were seen wearing face masks and shields, and their school staff observed health protocols aimed at preventing infection. Temperature checks, hand washing and disinfecting of footwears before entering the building were part of measures put in place. Iran's President Hassan Rouhani says education and health are equally important to the society, but added that parents would not be forced to send their children back to school. Several medical professionals have voiced concerns over the reopening of schools and universities in Iran, one of the countries worst hit by the coronavirus pandemic in the Middle East. And as schools, even here in Nigeria, prepare to reopen, here are tips and thoughts today, essential guidelines on how you can protect children from COVID-19 in schools. Experts at the CDC, Center for Disease Control, have recommended the following. Before school, talk with your kids about the virus, hygiene like hand washing and wearing face masks. Listen to their concerns. Practice mask wearing with the little ones. Praise their behavior to encourage it while they're at school. Check for high temperature and other signs of illness every morning. Load their backpacks with hand sanitizers and other cleaning products, as well as water bottles, so that the children don't need to use the fountains. You can also consider how they are getting to school. Some places are limiting bus capacity to 1 child per seat, halving the number of students who attend each day and requiring masks on buses. Now, after school, at the end of each day, consider a household protocol for when the kids come home. You might want them to remove their shoes and clothes before they come inside. Have them wash their hands immediately, wash the face masks they have worn, and talk with them about how school is going, interactions, and their feelings, just to get a sense of how school authorities are adhering to COVID-19 guidelines. Now, for today's turf, there may be a silver lining in the sky for patients battling severe COVID-19 cases, as a slew of gold standard clinical trials reveals that cheap, common drugs known as corticosteroids appear to cut the death rate by a third. According to Dr. Hallie Prescott of the University of Michigan, Ann Arbor, and Dr. Todd Rice of Vanderbilt University in Nashville, publication of new data on treatment with corticosteroids such as hydrocortisone or dexamethasone represents an important step forward in the treatment of patients with COVID-19, particularly with debilitating health conditions. The physicians wrote an editorial accompanying 4 studies on corticosteroids and COVID-19, all published online September the 2nd in the Journal of the American Medical Association, JAMA. One of the studies was a review of data looking at the combined results of 7 different clinical trials. Those trials involved more than 1,700 critically ill COVID-19 patients treated at medical centers in 12 countries. Now, in what appears a nod for that treatment on corticosteroid, the World Health Organization has also issued guidelines for its use for patients with a severe case of COVID-19.
Because people with NCDs are at high risk of severe COVID-19, finding effective therapeutics for these patients is a high priority. Earlier this week, WHO issued new guidance on the use of corticosteroids to treat patients with severe COVID-19. Evidence shows that corticosteroids can be life-saving for patients on oxygen and ventilators. However, corticosteroids do not help patients with mild or moderate disease and can be harmful. WHO therefore recommends the use of corticosteroids only in patients who are severely or critically ill.
Now joining us to look at the potential of corticosteroid for the treatment of patients with severe cases of COVID-19 is public health physician Dr. Oladoyin Odubanjo. Welcome, Dr. Odubanjo, to COVID-19 Myths and Facts on TVC.
Thank you very much.
Now, in order to save our time, I'd like you to, first of all, give a very brief background on the use of corticosteroid prior to this scientific research. And then, given the fatalities recorded from COVID-19 throughout this pandemic, much of this pandemic coming from patients with underlying health conditions, could this be the silver bullet needed to deal decisively with the pandemic?
Well, what's been happening is that, of course, at the very beginning, we're dealing with a disease that was up to now unknown. So the best that anybody knew was to start comparing with its distant cousins, perhaps. That is the MERS and the SARS that happened years ago. But then looking at those conditions in a bid to try to find similarities and treatment options, it was found that, corticosteroids, which basically are drugs that help to control what we call inflammation, which is really about your immunity fighting a disease, more or less, very often. So you get these inflammatory reactions. And in COVID, it's found that this can be very severe and oftentimes leads to death. So we have what you call a cytokine storm, which is a very severe immune reaction. So we talk about your immunity decides I'm going to fight and I'm going to fight dirty. But in a bid to do that, it actually destroys the body in itself and dies, and the person dies off. So the question was, in MERS and SARS that had occurred before, which are severe respiratory diseases, it was found that corticosteroids really didn't help very much. So it looked like this was not something that was going to be useful until actually I think one of the very first studies that looked at this and gave us hope was the study in the UK called the Recovery Study in June. And when they published their results, they found that corticosteroids actually helped reduce incidence of death. And that was the very first time, actually, that any treatment option was shown to have any effect on severe disease, critically ill patients. So in most cases, patients who were mild, asymptomatic, or mildly sick, or moderately sick, you could manage them one way or the other. But once they were severe or critically ill, it looked like nothing worked until in June that study was published. And since then, several studies have been done, like you've just referred to, in many different countries, Brazil, the US, Canada. And now a comparison of all of those studies is what has brought further confidence on the use of corticosteroids to say, yes, they indeed help. And perhaps are the first set of drugs now. So the silver lining part of it really is that this is now a drug that we can say that when people are critically ill, severely ill, there's something that can help them.
Dr. Dr. Oladoyin, recall what happened with hydroxychloroquine, how the price just shot up. Now, following this scientific research and the nod given by the WHO, how can this drug, corticosteroid, be shielded from its price going up such that it becomes inaccessible to critically ill sufferers?
Well, the truth of the matter is that you can't entirely prevent such things. You know, there will always be people who want to make gains out of it. But the first thing is that you shouldn't have a drastic increase. Why? Because this is not a drug that you should go and start using by yourself. You know, so unlike hydroxychloroquine and other options, which are over-the-counter drugs that people can go buy readily and just use, these actually are drugs that you are cautioned against using them, especially in mild or moderate disease, that it could actually be dangerous. You know, so these are drugs that should be administered in severe cases only and under the supervision of a clinician. So you should not have a rush demand in that sense, because it's not a drug that you should try to just be taking by yourself.
All right, Dr. Oladoyin Odubanjo, public health physician, talking to us from Lagos. We thank you very much for your contribution on COVID-19 myths and facts. Thank you very much.
My pleasure.
And I'd like to reiterate here from what the WHO has said and from what our guest has said that corticosteroid is not for those who are mildly ill, showing mild symptoms of COVID-19, but for those who have debilitating health conditions. That's our package on today's edition of the program. Thank you for watching. Remember, whatever you do, stay informed and stay safe. Bye for now.